All right, today we're going to talk about Reye syndrome. So, Reye syndrome, the pathophysiology basically is that a child has a viral illness like varicella or the flu. Actually, they found that in close to 80% of cases, it was varicella, influenza A, influenza B. Those were the biggies. Um, So during or shortly after this, while they are sick or shortly after, they're treated with aspirin. And then within 3 to 5 days of their illness resolving is usually when they would see this occur. So it's a sudden swelling of the liver, which then leads to increased ammonia levels, which then leads to swelling of the brain. Which then leads to death from brain herniation. Um, you can develop Reye syndrome because you've been exposed to other things like pesticides or herbicides. And then there's some children that have a fatty, like a oxidase fatty metabolism problem that nobody knows about, and they can develop this as well. But most frequently, it is seen in response to aspirin being given during a viral illness. All right, so the prognosis is death in 20 to 40% of cases. And depending on how high the ammonia levels are, if a child survives, they will likely have brain damage, differing levels of severity. So these are the cues that we're going to see in the patient who's being brought into the hospital who may not have been diagnosed with Reye syndrome, but this is why their family brought them in. They have profuse vomiting that's got like no effort behind it. It's just like not gagging, no heaving, just vomiting. Lots. And pretty severe mental status changes. They get very irritable, then they become very lethargic, then they get very confused, and then they are completely disoriented. And this all occurs due to the brain swelling and the ammonia levels. These are the diagnostics and labs that we can do to try to rule out or in Reye syndrome. We're going to see elevated LFTs because the liver is swelling and fatty deposits are being thrown out into the bloodstream. We're going to see very abnormal coagulopathy studies. So PT and PTT are going to be very, very abnormal. The glucose is going to plummet. So they're going to have so low glucose levels that it will lead to seizing. And their ammonia levels are going to be extremely elevated. So the interventions and actions that need to occur when a child is being brought in with all of these signs and symptoms, so things that look very neurologic, the mental status changes, the lethargy, the irritability, the profuse vomiting. As soon as they're brought in, we need to do a really quick assessment and history by asking if there was a recent viral illness and did they use any salicylate products. So I think it's a good idea for everybody to do a quick Google search and find out what types of products in the home have salicylates in them or aspirin. Because we might give our children something that does not blatantly say aspirin on it, but it contains aspirin, and we can lead to this. So back in the day, like the 1970s is when they first started really studying Reye syndrome. Um, they made the connection between viral illness and aspirin use because I think they said somewhere upwards of 85% of children were found to have salicylates in their bloodstream when this was developing. Um, so back then, they used to call an 81 milligram aspirin a baby aspirin. And this leads to parents giving those aspirins to their children because it literally has the word baby in it. So if your child is sick and they're running a fever and you want to bring their fever down, you go to the store, you buy some baby aspirin and you give it to them. And because of Reye syndrome and all of the studies that were done relating to it, they were able to pretty much worldwide change the name and the labeling of aspirin to be considered low dose aspirin as opposed to baby aspirin. But if you guys think about the adult patients that you come in contact with, they frequently still call their 81 milligram low dose aspirin, they still call it a baby aspirin because it was there when they were growing up, and that was what we called it. Um, So once we've determined that there was salicylate use and a viral illness within the recent past, then we're going to want to do strict I's and O's. We're going to monitor their glucose. We're going to monitor their bleeding time because we want to control cerebral edema, prevent dehydration, prevent disseminated intravascular coagulation, and we want to make sure that we provide seizure precautions because all of these things, their encephalopathy and the liver failure is going to lead to seizures. So this slide, it's very ICU driven. These children are acutely ill and need to go straight from the emergency department to the ICU. So right now, you guys don't need to memorize any of this or know any of it other than understanding what they're doing. So we place a central line, we intubate, we put them fully because we're going to do, like I said, strict I's and O's. The patient's going to be placed on some form of dextrose containing fluids, so D50, D10, D5, depending on the level of hypoglycemia. And we're going to want to keep those glucose levels between 100 and 120 milligrams per deciliter. We don't want it to go too high and we don't want it to go too low. We're just going to keep it right in the normal range. These children are going to be highly acidotic, so we might give them sodium bicarb. K-exalate can be used to bring down the ammonia levels. Fresh frozen plasma or vitamin K can be given to treat the coagulopathy that they're going to have. Sorry, my dog's barking. And the head of bed should always be 30 degrees for any patient that's having intracranial pressure, which they will be developing because they're literally having encephalopathy, which is a whole lot of pressure. We're going to control their fever because good fever management can lead to less swelling and less seizing. We're going to be monitoring the level of intracranial pressure and possibly give them mannitol or hypertonic, like a 3% saline, to treat any potential cerebral edema that's already occurred. These are some of the complications that we're going to see in a person who's developed Reye syndrome. Seizures, they could be ongoing for the rest of their life. Cerebral herniation, which is going to lead to death. Aspiration pneumonia can develop because of the vomiting. And it's likely because of their level of consciousness changes plus vomiting that they aspirated already. They're going to develop cardiac arrhythmias, pancreatitis, GI bleeds, respiratory failure and renal failure, sepsis, and then, of course, death. So what I want you guys to know about Reye syndrome is that we don't ever want to expect it to come in the door. It's actually so rare now that it's maybe only seen 2 or 3 times a year across the United States, which is amazing. Um, but we need to educate families that have low health literacy or are coming from another country and utilizing our products here that are poorly labeled. We want to educate them to never, ever, 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 ever give an aspirin or salicylate containing product during a viral illness. Because as long as we do that, we're protecting our little ones. Okay? So Reye syndrome is viral illness plus aspirin leads to liver swelling and death, leads to brain swelling and death. Okay? That's what I need you to know. Thanks for listening.